My name is Carolina Tessie. I'm from Block E, and this is my wound care video. So upon entering the patient's room, I have performed hand hygiene. I've also introduced myself to the patient, obtained the consent, and explained the procedure. I have also made sure to elevate both the bed and my workspaces to the level of my waist, and I positioned the patient so that the irrigation solution flows downward towards the pad by gravity. I've also made sure to do a full room scan around the room to make sure that there's nothing that could potentially break my sterile technique. And in a real life situation, I would don my PPE, including goggles and a mask. So now I'm going to perform hand hygiene once again, so I can put down the pad. So now that the pad is placed down, I'm going to perform hand hygiene once again so I can don my clean gloves. This would be at waist level, of course. Okay, so now I can take off the bandage carefully, and I can inspect it for any signs of infection. I see that there's no pearly wound discharge, which is a good sign, and when I inspect the actual wound itself, I can see that there's no signs of infection, so no abnormal swelling and no abnormal redness, which is good, and I could also palpate it at this point as well. So I'm going to throw this out in the garbage, and I'm going to throw this out as well, my clean gloves. Carefully doing so I don't touch the part that I shouldn't. And now I'm going to perform hand hygiene once again. Okay, so now I'm going to begin by opening up my dressing tray, my sterile dressing tray. I'm going to make sure that it is sterile, like I see no markings or any like holes or anything, which is good. And I'm going to rip it where it showed me to cleanly and throw that out. Now I'm going to open it carefully, place that down. This kit does not come with the garbage bag, so I'm going to use this as my garbage bag. So I'm going to use some tape. And this would be at waist level too, preferably. So now I can open up my kit. I'm going to be mindful of the 1-inch border. So away from me first, to the side, and in real life I would not want it hanging like this either. Away, so to the side, grab my forceps, and towards. So I can use my forceps now to grab the extension of the sterile field, and carefully with the 1-inch border, place down my transfer forceps carefully, and I can use this as an extension of the sterile field, carefully placing that down. So now I can begin by placing my supplies inside the sterile field. So first, my irrigation syringe, using banana peel method to open it up. Transfer forceps. My blunt needle. Next, I'm going to use the scissors, banana peel method, place them on the edge of the sterile field. And next I am going to open up my abdominal pad. And my ribbon gauze. This is a new bottle. And I'm going to carefully take out as much as I need for my patient. The wound's not too big, so. And now I'm going to pour some irrigation solution into the third compartment. Now, this is a new bottle, so I don't have to pour any out beforehand. Covering the label with my palm, and I'm going to carefully do this so I don't spill any. Generous amount. Close this back up. So I'm going to make sure I have everything. It looks like I do. So now I'm going to use these transfer forceps to take out the old ribbon gauze. Throw both of these out. So now I can begin by measuring the wound before putting on my sterile gloves using banana peel method. Carefully grab it with the tip, and I can use a chart over here to compare length, width, and depth. So the length is 5, the width is 3, and the depth, carefully doing so, is 1. So now I can throw this out. So now I'm going to don my sterile gloves. I'm going to do this using banana peel method. Carefully doing this so I don't break sterility. And I can grab from right here and stick my fingers in there, like so. Okay. And now I can just carefully stick my fingers like that. And do this carefully. Okay, now I have my sterile gloves on. I'm going to be careful of what I touch. So I am going to start the process of irrigation first. I'm going to grab my irrigation syringe and the blunt needle. And draw up the solution. Okay, now I'm going to irrigate the wound, and I'm going to do this in a zigzag pattern from top to bottom, clean to dirty, and follow the prescriber's orders or until it is clean. And of course the patient is positioned so it will drain down towards the pad. Okay, I cannot throw this in the garbage because there's a needle, so I'm going to put it back in my sterile field until I'm done with the procedure so I can throw it back in the proper bin. So now I'm going to dry my wound because it is a little bit too wet. So I'm going to use my 2x2 gauze. And just go from clean to dirty. One wipe, top to bottom, and then throw it out. Once I lift up from the wound, I have to throw it out. Okay. Next one. Now I'm going to do the side furthest from me first. One swipe, and I have to throw it out. Next. Now the side closest to me. One swipe, and I have to throw it out once I lift up. Clean to dirty, so top to bottom. And I do this until I'm pleased with the results. So now I am going to move on to packing the wound. So I'm going to grab the ribbon gauze I previously placed in here, and I'm going to wet it a little bit first. And I'm going to wrap it around my ribbon gauze. I'm going to take my forceps and I'm going to pack it inside the wound. Careful not to impede any blood flow, so don't make it too tight. But I'm also not going to, I'm going to make sure that it stays inside the wound and doesn't go outside the wound. Okay, so that looks good. I don't actually need these anymore, so I'm going to throw them out. And now I'm going to cover the wound with some 4x4 gauze. Okay, so now it's covered. I'm going to put my abdominal pad on top of that. Okay, and I can actually take off my sterile gloves now. The wound is covered, and this way I can tape it easier. So let me tape the wound. And I would do this on all four sides. Okay, so thank you and this will secure the wound. So now I'm going to document that I'm going to wash my hands first of all, perform hand hygiene. I'm going to document that I have performed wound care, and I'm also going to position my patient so that they are comfortable, and I'm going to begin my cleanup. Thank you for listening to this video.